welcome students to this module of NPTEL on healthcare research, healthcare database. We are on the 5th lecture to understand health database from LASI. LASI is one of the very finest data set available in India and along with many collaborators, and we are going to use it for our analysis. So, I thought it is better to include in the model. That is this database is explaining about our old age, okay, longitudinal aging survey of India. So, let us move forward and understand the details of this data set. Myself Dr. Pratap Mohanty. I have been teaching over 14 plus years, and the research methodology class I have been teaching over 6 years. And regarding healthcare research, I have been working on this area and trying to specialize in this area. And I have already handled a previous course on handling large scale data set with Stata. So, this time it is purely on healthcare research. We will be providing hands on experience on data sets and its analysis. In the introduction, I will give you the complete backdrop of the requirement of LASI dataset, why longitudinal aging survey is necessary, and what is why should we focus on the research on aging population, as we know that India is heading towards the population. The most populated figures in the world. This is at present the second ranked. It is expected that in another 10-15 years India is going to be the most populous country in the world. And it's not just the total population that matters, it also matters its composition of population, age structure of its population. Okay. So, population aging is important within the composition of population. Why it is important? Because it represents major policy challenges and threatens to topple existing insurance pension systems and create health system overload. Thus, it calls for a review of existing models of healthcare, familial and social support. So, the existing healthcare model has to be reviewed, since we are our population is becoming aging. Though at this moment India has huge young population, much better than that of the Chinese, and that is why often it has been discussed with population dividend in the literature. So, in the 21st century, the phenomenon of global aging has the potential to fundamentally change the burden of disease, the healthcare system and its cost, family and social structures, economies and trade, and human migration really matters in the present context. The share of the elderly population is projected to rise to 19.5% by 2050 as per the UN Population Division 2019. So, by 2015, 50 we will have a population of 319 million rise in the population. Okay, while increasing longevity and falling fertility have also resulted in a demographic dividend. The present phase of population transition is that we have increasing longevity and falling fertility. All right, the death rate has been reduced, as well as the crude birth rate has also been controlled. In that case, we are left with young population, and the dividend is expected to be very high. So, in this context, it is important to highlight the dividend. And that is possessed with the elderly population, especially 60 years and above. If they are not guided from the pre-elderly to the elderly, pre-elderly we mean 45 years onwards. So, that may create some forms of disasters. So, the dramatic increase in population of elderly and 60 and above in absolute and relative terms are important dimension of research in the present age. So, older age here we refer to 45 years and above. These form an age group that represents free aging and pre-retirement phases. This 45 years and above, this is basically called pre-aging. 60 years is called elderly population. Oldest population is defined as 75 years and above as per the ILUH and WHO definition. Even this report has also clearly mentioned that these are different brackets of old age population: pre-elderly, elderly, then old age, oldest old, 75 years and above. And why this study is essential? Because when the population are becoming aging, the persons are becoming aging, or persons are aging, it has social, economic, and health dimension primarily. Those social dimension include social structure, the perseverance of the society, the social networking, the societal adjustment within the family structure, how old age are being put, how they are being treated within the social norm. These are becoming challenging in the present day context. They are often understood in different newspaper article of their desertion. They've been highly deserted in the old age, and most importantly the old age care units are not well built in Indian context. So this segment is upcoming. Therefore, a study is very essential. Then coming to the economic front of aging, economics, we since persons are aging, the morbidity percentage is also expected to be higher, and so the aged population and their expenditure, their healthcare unit, their inpatient care expenditure, their nutritional requirement, their settlement, their protein diet, their all sort of aspects require management through its economic front. Okay, how the budget should be allocated on them, how their pensions should be dealt, how their insurance schemes are dealt, whether those are settled correctly or not, since old age population are rising. So it is essential for a detailed study. Now similarly, health dimensions of aging. So as we already mentioned, there are various indicators of health dimensions, and those are included in this survey. So these all suggest that there should be an exclusive study, and the LASI has already considered it. Now coming to the LASI data sets, this stands for Longitudinal Aging Study in India. Okay, LASI. The LASI is a biennial panel survey. It is quite representative one of the older and elderly population with age of 45 and above. This 45 and above population, as I have already said, that this includes free elderly, and for and late elderly, or oldest old population as well. The wave one, why wave one? This is a longitudinal survey. Longitudinal survey, it is going to give the person and a study over time period. Okay, this is going to give us panel data, panel information. Panel information means it's repeated cross sectional. The cross sectional units are repeated in different time period, and this is going to be very helpful for policy making, for policy evaluation or evaluation of the elderly programs. Okay, and so far only one data set, one round has been released. And though the pilot study is also is there, that was conducted in 2010. We are going to discuss these details. So first the wave one, the wave, the word wave is written for the longitudinal data. So wave one included all Indian adults and all elderly men and women with the age 45 and above, and their spouses. So this is important to note. Their spouses who reside in the same household are also covered. Now, one critical aspects of this data set is that if the spouses who are also covered are also asked for as the respondent, they may not be of 45 years age. Okay, so that's a concern you need to thoroughly understand. Okay. Then the kind of well-being of the elders, the kind of welfare analysis we want to do, certain behavioral analysis we will do with the data set. But the spouse age is not in that bracket, then it is going to be problematic. Okay, but what sort of research question lies in that section we are going to understand. LASI is a collaborative project of the national and international institutions. National institutions like India Institute of, International Institute of Population Sciences located in Mumbai, NPHCE, MOHFW, NARI, Pune in Pune, CRF in Pune, international institutions like HSPH, that is in University of Southern California, University of California, University of Washington, RAND Corporation of USA. So these are the institutions attached with the study. The financial sponsors of the study are NPHCE, MOHFW, Government of India, National Institute of Aging USA, and United Nations Population Fund, UNPF of India. Okay. So in the introduction we have discussed all those things. Coming to the certain goals of this LASI data set, this helps in developing and implementing a nationally representative longitudinal survey of adult health and aging in India. This provides data that are internationally harmonized with the HRS, that is Health and Retirement Survey. International there are data sets, and this has also tried to go as per the standardized or harmonized codes, harmonized variables. So international data set and its sisters around the world to provide de-identified data to the research community in a timely manner. So though data but not exactly identified, but certain codes are given, certain identifiers are given for each research community, research respondent in different time period. So this is broadly speaking, this gives representative data about adult age, especially aging, and that too if you are interested to work for so many countries. This data set is also comparable. So that is one of the important aspects of LASI data set. LASI pilot survey was conducted in 2010, was carried out in 2010 to test the survey tools and to understand the process for the final survey, and that was conducted in 2020. Okay, so I just wanted to go back to check once again. All right, that's just fine. So just a minute, I'll come back to it. Okay, this was all Alright, so goals I have mentioned. So I am coming to the 2010 pilot survey. This has given survey tools to understand its main survey that was conducted in 2017 to 19. The LASI pilot survey was conducted in 4 states. Pilot was made in 4 states, so Karnataka, Kerala, Punjab and Rajasthan. But it has not given whether these are going to be representative, but in small scale those data could be compared. Punjab and Rajasthan from the northern part and Karnataka and Kerala are from the southern part of India were taken, not exactly the southern south or northern Rajasthan is not really defined. Okay. A sample of 1600 older adults with age 45 years and above was drawn using stratified multi-stage area probability sampling design. So it has again followed multi-stage area probability sampling. So in any case probability sampling is there, and this is stratified to different strata are defined. So the pilot data was collected through face-to-face interviews conducted over a period of 3 months in the LASI pilot survey. So it was a face-to-face interview and that too spanned over 3 months period. Okay. So this is the background of the LASI pilot study. The analysis of the LASI pilot data revealed insightful evidence on reported and measured health status, social network characteristics, income and consumption, retirement and pensions of the aging population. The LASI pilot data can be obtained by filling the data request form and through the process we will be guiding. The LASI data pilot report is also available on IIPS India website. So this pilot survey gives information or report on major health status, social network characteristics, income consumption, retirement and pensions of the aging population. So you can take note, social network is there, those who are working on these issues they can compare. Similarly pensions issues are there, retirement and pensions. Income and interesting part of this is that it gives better structure about income and consumption. It is unlike the NFHS data set. Okay. Then how you should go for it? You should actually also try to understand this pilot of 2010. Let me read: number of household, number of interviews with LASI age eligible individuals, number of biomarker responses and response rates according to the place of residence covered in the LASI pilot 2010 is given here. Like in the pilot, the household interviewed were of 950. I will check once again the figure which I have already said. 1600 older respondent adults were there with 45 age and above. Here we are also going to mention around 1600. Look at the individual interviews. So it is of number of age eligible individuals and number of age eligible interviewed. Okay. So finally interviewed was of 1600 plus 1683. And the biomarker interviews were also taken. Of those persons, out of them only 1530 around 1530 respondents were there. Dried blood samples were collected on 1356 persons. Okay. So the response rate here as well in the household level response rate was 92.68, whereas the individual level it is higher, it is 95.57. Let us compare a bit for urban and rural. In NFHS rural representation were better, but here household representations were better in urban areas. and especially for the individual responses, it is relatively better in rural area. Okay, biomarkers informations are taken better in rural areas as well. This table is also unweighted. We presented in case of NFHS. Similarly, it is unweighted. What weight should be taken will guide you through the process. Okay. So I think I have already mentioned everything. Let us make a move to the next slide. LASI Wave 1. We are now trying to understand LASI Wave 1. This is in fact the world's largest and India's first longitudinal aging study conducted in the year 2017-19. This is also called Wave 1. In every 2 years, I think other rounds are going to be conducted. Till 25 years, study will be there. The LASI Wave 1 is a national representative survey. Those who are not familiar with what do you mean by national representative, that indicates in simple term at this moment I am guiding. This indicates that your results, the data and its results are going to represent the Indian figures. So like in any kind of estimation you do, you can claim that this is what happening in all India level. Okay. So national representative here in Indian context we are saying. So Indian in pan India level. Okay. So there are of 72,250 older adults with the age 45 and above, including spouses, irrespective of their age. Now this is what I said, including spouses, irrespective of their age. This is one of the catch. We have to be careful while analyzing the data set. So spouse is usual in Indian context. The wife between husband and wife age is less. On the average it is lesser. So that means whoever are the respondent of 45, we may get very lower age group. But if you are simply getting the responses on the average, those persons who are in the young age, they might have also given their responses. That may not be giving right result if you are getting the average of those old age responses. So we may need to carefully check their age. Okay. So all may not be of 45 years and above. So that is one of the aspects we need to be careful while checking or testing with the result. This data set Wave 1 covers all the states and union territories except Sikkim. Sikkim is excluded, that is not included in this survey. There is no upper age limit of the respondents. And it also includes the collection of biomarkers as well. Biomarkers markers are also attached. LASI dataset is envisioned to be conducted in every 2 years for the next 25 years. I have already mentioned this. For another 25 years, this data is going to be available. Okay, so that means in every 2 years it will be conducted. So at least we will have 12 waves, and this is going to be very interesting dimension for research. Those are the researchers at this moment working using the old age data set, that is LASI data set. They are going to exercise, going to experiment for another 12 years for their policy making. Their results will be quite interesting since these are longitudinal data. Okay, the age of 45 is chosen to harmonize the survey with the sister studies, the worldwide health and retirement study, HRS study worldwide, So this has attempted to also sync in sync with the existing sister studies. Okay. So why 45 years a year as the age considered as the benchmark is because of this reason. This has also allowed measurement of pre-retirement behavior. Okay, so pre-retirement behavior, like before retirement, there are certain understanding with the person. Like you might have heard in the news or from different persons, those who are at the pre-retirement, they might be they might not be serious in their parent organizations where they are working. They used to say that I'm going to get retired on another 1 year or so I'm not putting my efforts. And regarding healthcare behavior, they might be over conscious, since they are approaching towards 60. Okay, so they might be over conscious about their health. So we need to check the original data and the responses those are received, and to identify whether this is correctly fitting to the analysis for the Indian context. This data set determines the early onset of chronic diseases among adults. This is what the healthcare aspects which I wanted to refer. Early onset of chronic diseases among adults. So if we are referring to before 45 age, early onset of some of the non-communicable diseases, NCDs could be well tapped. So and the next aspect we will emphasize it is coverage of LASI data set, that was of 72,250 individuals covered on this wave 1, and it includes everyone, all age above 45 and above. Okay. So out of these 72 and 250 individuals respondents, we have in this data we have 31,464 elderly. We have defined the age group, that is of 60 years till 74, and 60 years and above elderly, and out of that 6,749 old age persons with the age 75 above. And so they are also covered, and if you want to stick to their individual perspective, you can able to find out correctly. Okay. Now we are guiding how to download this data set. If you are very new to IAPS data set, in the last lecture I have guided you about IAPS data set. It is National Family Health Survey data, and that is considered to be one of the best data set for the women questionnaire. Here we are focusing on the old age. The old age covers information about the all phases of their old age period. You can click on this website iapsindia.ac.in/LASI. LASI gives information about it correctly. To go to publication section on the website and download the request form and fill the form and send it to the data center. Email is presented here, is given here. The IPS usually can take 1 day to 2 days, okay, to respond, and on its working days to make you available with the data. Now the longitudinal aging study LASI data set, it's how you could able to request the form we have just given you. For your clarity, you might get confused, what is that form, who is form, how it looks. You can choose like the purpose of the study for the PhD or others, like format of data set, you may take data format or SPSS data format, okay, and which file you require. In this case, I think you require the community data set, household data set, and the member file as well.
individual, household, and all data sets. I'll suggest you to download. Give the and at the end, write down your reasons for downloading or your research topic for what you are working, and with your signature, you just send it to the
email I have guided, and your data will be sent to you, or the link will be sent to you by the office, IPS office. Okay. The first national wave of the LASI provides in-depth data on aging, economic aspects, health status, social relationship, social support, family, social satisfaction, and these help in determining the specific needs, circumstances, views of aging adults in the light of changing social and familial circumstances. Over the time, I think we all know that the society is changing, society is getting reformed, society is adopting various practices, especially in the digital days, in the ICT days, in the automation. Old age are the biggest prey to various difficulties, and they are completely isolated, especially in the young generation, are more charged with the social networking sites, and much information they used to get it through that, whereas the old age are not trained, and they usually are well connected with their peers, and because of the economic transformation or the structural change in the Indian system, these groups are highly isolated. That is the biggest concern, and not just isolated, this has long connection with their health issues, especially during COVID-19. This is quite important, this is really important, because in the COVID-19 over last 2 years they are completely paranoid, and these groups require huge support. Their usual consultation with the doctors are delayed, and there have been in many instances where the old age sections burn the huge burden of the disease of this pandemic. Many old age population could not able to continue sustain their life. Okay, and that's not due to the virus itself, that's really due to the present healthcare system, and how our later ages and their age group populations are dealt, and how they have been actually managed. This is a bigger question at this moment, and I'm sure if you target yourself to do certain study on this light, I'm sure your work is going to be relevant for some years. So the LASI's key objective is to provide comprehensive data on the following aspects. This gives comprehensive information on demographics, work and employment, household economic status, their biomarkers, about their health conditions, especially their chronic health conditions, insurance, health insurance, healthcare utilization pattern through the insurance, symptom based on health conditions, their family and social networks, and social networks like their acquaintances with different layers in the society, how frequently they meet, and how they are discussing, especially in the COVID-19 period they are in trouble. And though this data doesn't give, but the next wave would be maybe they have to cover it. The functional healthcare aspects are also mentioned. The welfare programs which are relevant for this group is necessary, and that those are also covered. The mental health aspects is the emerging one in the section, and they are also dealt. The retirement issues, satisfaction, life expectations, etc. are carefully covered in this data set. The LASI data sets include 3 separate data files, namely household file, individual file, and community file. One of the important aspects of this data set that it covers exclusive details, comprehensive details on community file, where the old days are highly connected. Okay. I'll suggest all of you to follow this questionnaire, and you will get lots of inferences about your other research, maybe policy based research you are targeting. This what is the in this data set we are now discussing about the sampling design that was followed. It is of the LASI adopted multi-stage stratified area probability cluster sampling design. So, some of the sampling probability sampling design we have discussed. So, here it is only differentiating with clusters. So, we have already discussed about cluster sampling in our earlier module in my previous module on handling large scale data set. So, LASI adopts also 3 stages sampling for rural and 4 stages in urban areas. Okay, 3 stages for the rural and in urban there are 4 stages of sampling. In the rural, first stage is of their primary sampling unit, how to select the first PSU, that is the sub district, that is the TSL level in the rural area. Once the TSL is determined, then the second stage is to identify the village within the TSL. Then the third one is of course your household within the village. Okay. So, the selection of household from the village is also important, and that has been covered in 3 layers. But in urban areas there are 4 layers, 4 stages. First is the PSU, that is the urban talukas or tehsil in urban areas. Then within the tehsils, I think we all know that there are through the census enumeration blocks of census we can find out their selection of words. Their word selections were there. Then third stage is the CEB, selection of 1 CEB census enumeration block in each word randomly. Then the fourth stage is of household within the selected CEB census enumeration block. LASI is conducted using 3 schedules, which I have already said. First schedule on household survey, second one is individual survey, third one is on community survey schedule. Okay. Community survey schedule is very essential for further research. Household survey schedule, it includes household roster that also gives information about the household and their environment, housing conditions, household consumption, household assets and debts, household income and household health insurance. All right. Then in the individual survey schedule, they have the schedule was administered to each consenting respondent of 45 years and above and their spouses irrespective of their age in the sampled household. The individual survey was designed to collect detailed information about individuals in the following section. They covered in the individual schedule about demographic module, work, retirement, pension module, health module, mental health module, healthcare service utilization, family and social network, social welfare schemes module, experimental module also, where they have also included time use, extent of time they have put in, and expectations and social connectedness. All right. So, this section is very important. LASI also includes an individual module on biomarkers and their direct health examinations as well. Last module it has included is on community health survey schedule. This is administered at the community level, of course, that is in villages, in rural areas, and the census enumeration block in urban areas. Okay. This is in fact designed to answer on several front, like village level elected representatives, panchayat staff, government health program staffs and community leaders. So, it is very finest aspects are included for research. The community schedule includes sections on population characteristics, infrastructure and common resources, the accessibility and availability of healthcare services, and the coverage of health and social welfare schemes are also important for analysis. So, I think I have given you all the backdrop of the LASI data, how to download and what are the important features, what are the coverage, who are included, who are not included, its age group, different layers of its age group, okay, different variables included. I think these are quite important for you to start research on old age population. So, I will be guiding all other details in the next class. With this, I think it is time to close. So, I suggest you to please follow the details. Thank you.